Hey everyone, this is Dr. Jeff Horowitz with Dentists in the Know. We're here at the Chicago Midwinter Dental Meeting 2026. And I've got such an interesting story for you here today because the last person I ever thought would approach me to talk about TMD issues and bruxism happens to be an endodontist, and that's who we're going to talk to today. So I'm with Dr. Bill Cliff. He's from the San Francisco Bay Area. He is a practicing endodontist, only about 75 hours a week from what I hear. But welcome to the show. I am so excited to talk about this with you, and I never expected to be approached about this, as I said, by an endodontist who has now formed a company called Asesso Health. So tell us where this came from. Why does an endodontist, the guy doing the most profitable thing in dentistry, decide, hey, I want to dip my toes into the TMJ world?
Yeah, thank you. Thanks for that introduction, Jeff. And I just want to say I'm really grateful for the opportunity to talk. Just met you about an hour ago. We kind of talked for a little while. I feel.
Oh no, we're cool.
I
We're-
feel,
yeah,
but
we're
I
cool.
feel like we need a couple of hours because we could break bread together.
Yeah.
So anyway, yeah. So tell you about my journey a little bit. Practicing endodontist in the Bay Area for about past 30 years, and I have a little energy around saying 30 years. But anyway,
You're in
yeah.
you're in a safe space right now.
Right. So, but I realized early on, patients were coming to me because they had pain. And, I'm in the pain business. I want to treat their symptoms, but more importantly, I just want to make an accurate diagnosis.
Right.
Right. And so a lot of people were coming in and they were having like these nefarious sinus like issues and, a CBCT, looking for cracks, looking for everything that we normally do from an endodontic perspective. And what I realized that an awful lot of my patients were actually just suffering from TMD. So, you know, you can imagine if you're grinding or you're clenching all night long, that tooth sits in a ligament and it becomes, inflamed, right? Because it's hitting all night long, right? And so even though there would be no filling, there's no visible cracks, but you tap on the tooth and it was a little sensitive. And I just didn't feel like it was appropriate to just do the root canal on a tooth because I
Right.
tapped on it and I got some symptoms.
So you're saying that there's more to the percussion test than meets the eye, right?
Absolutely.
Yeah.
Absolutely. So fortunate enough for me, a good buddy of mine, my mentor, happens to be an orthodontist, and he did his master's thesis on TMJ. So, unfortunately, in dental programs, we talked about this earlier, maybe 2 hours,
Yeah.
20 hours at a max on TMD. And so I just needed to learn more and I needed to be an expert. So I made it a point probably early on 2003 just to basically do a comprehensive TMD evaluation on every patient that came in.
I love it.
And so because
We're getting closer to breaking bread now. You know that. Yeah. Okay.
awesome, yeah. So fast forward, I remember giving a lecture, I think in 2016 to a bunch of my endodontic colleagues in my study group, and they were all kind of missing it as well. And, I'm sure you've seen patients that come in and they've had a root canal here and a root canal here and an extraction here and an apicoectomy here and an implant here. And you're like, what is going on here? I mean, are the teeth that broken down or what's
Right.
going on exactly? So I just wanted to be very intentional with, my approach. And I started basically sending my patients back to the GPs to make the orthotics, right? And unfortunately, invariably, they'd end up coming back to see me, and 6 months to a year later, I'm still having pain over here. Hey, did you get the orthotic from your dentist? I did. This is what's going on.
And then I'm gonna jump in and say, in all fairness to the GP,
No.
they just didn't get the education. So sometimes the splint would be made incorrect. There.
Doing
Yeah.
best
Right.
that they can.
Right.
Listen, I am not disparaging.
Yeah. I knew you were, and I just wanted
In
to.
any way. I mean,
Yeah.
listen, I had to coach myself up, to kind of figure this out. And
Right.
trust me, I've iterated over the years too, because I was one of those making the same night guard
Right.
that everybody else was
Right.
making. So anyway, yeah, in 2016, started referring patients back to the dentist. Invariably, they'd come back and see me, and I said, you know what? I actually need to start doing something about this. So I actually started making night guards on the side. And I basically just offset the cost of whatever the lab was charging me because I just felt like it was a little awkward,
Yeah.
I mean, referrals or sending me patients to do the root canal. And listen, I'm not trying to, butt in on their thing. It's just that I got so many patients that came back to my office. And the biggest point is there's a lack of compliancy. Okay. So, patients don't want to wear these big acrylic, grain guards or night guards, whatever you want to call them, orthotics. Or they come back and they wear, I've got an aligner tray that opens up the bite a millimeter and, doesn't put the muscles in a relaxed position. The major pain point of all of these patients, and I would say 75% of everybody that comes in on my office on a daily basis has TMD. They have flat teeth. How do they get flat teeth? I mean, unless somebody took a bird to their teeth or they took a file to their teeth, they're grinding their teeth at night. And you ask them, hey, you're grinding? I don't think I grind. My husband says I doesn't grind. I think that might be more of a clencher. Well, clenching is actually worse than grinding.
Yeah.
Because as you know, the Newton forces on the teeth are massive. And I don't want to get into the physiological aspect of that, but you can have your molars, which are basically about 1,000 pounds per square inch on the height.
Yeah.
But if you magnitude all of the teeth together, I mean, it could be like 10,000 pounds per square inch.
Yeah.
And you're wondering why people are cracking their teeth, I mean, this is why that's happening. So we've actually went out and we've measured all the forces. We've actually gone out, tested all the muscle fatigue from the masseter muscle copping out and the temporalis, so like I said, when I do a comprehensive exam, I always ask the question, hey, by the way, do you suffer from frequent headaches or migraines? They're like, oh, my jaw's sore in the morning time. People have tinnitus, people have, they go into their physicians for, these nefarious sinus-like infections all the time, and they get marketably poor sleep as well.
Absolutely.
And so, so I wanted to be thoughtful, but I wanted to do something that was very intentional, and I wanted to give them a comprehensive solution. So I didn't want to just...
And something that could be done immediately, right?
I think that could be done immediately.
Yeah.
That's a great point.
Yeah.
And so I wanted a comprehensive solution. For those people, you can imagine where first responders, where sleep is so important for them. Professional athletes that like to geek out like with their Fitbits and their Whoops. How many steps did I get today on their Apple Watches and all this? I wanted to give measurable metrics back if you wanted to see that. You wanted to see the improvement. I've been making thousands of these, and we've compiled about 200 cohorts where they have been integrating with our dock and our sensor and our night guards. And what we do is we get a baseline of 3 or 4 nights without them wearing the night guard, so we can establish a baseline. And then we have it's called the little sensor that they can wear this at the middle of the night. They put it right on their masseter muscle. Has a gyroscope, accelerometer, so it knows all positions. We've done all the machine learning on it. When are you talking? When are you yawning? When are you waking up? When are you waking up in the middle of the night? When are you, sitting up, laying in bed? When are you...
So is there supporting the position all night long? Because I'm going to tell you, there's so many more applications. Let's show everyone what we're talking about.
Yeah. Okay.
For the people who are going to listen to the podcast, obviously you won't be able to see this.
Yeah.
But if you go to our site, one of our sites, our Instagram page, we will certainly do a little clip where everyone can go and look at this on the Dentist in the Know Instagram page. And then obviously they can go to your website as well, which is
AsessoHealth.com.
What is it?
Asesso
Health. Spelled ASESSO.
I'll tell you the story.
Where did the name come from? Right.
There you go. So my mom was born and raised in Greece, so I am Greek, right? And Asesso was a Greek goddess of healing.
Okay.
So that's where but we assess the patient as well. So so I just kind of thought it was fitting, and so
that's a great play.
Anyway, yeah,
I love it.
We just played off of that.
So maybe hold this up for the camera.
Your hand, by the way.
Yeah, I
like it. Yeah, you like it.
And I like the so this actually has a UV light in it that disinfects it. So this is an immediate...
Before you lose on to that, I got to give credit to my wife.
Okay.
She's like, yeah, you have to have a little disinfectant element, and she's like, people are going to love
this.
So,
what is the first thing when I give out a sleep appliance or a TMJ appliance? oh, you can go on Amazon and pick up one of these because you're going to want to disinfect this, on a regular
Yeah, you
basis.
can rinse it off a little
Well,
bit.
I'll let you hold it up because some people are going to watch this on our YouTube site. So if you would maybe hold it up for the camera there. There you go.
This is it. This is the element in here. This is what actually treats the symptoms. So it's an immediate orthotic, and it has a patented slope design on it, EVA material and PEEK material. And it basically opens the bite between 7 and 10 millimeters, and it puts the muscles in a relaxed position. And let me just go down the rabbit hole before I go more on the product side. What is TMD exactly?
Okay.
And why does bruxism occur? Well, once upon a time when you were a young kid, 5 years old, 6 years old, 7 years old, you fell down at the playground. You got hit in the face with a soccer ball or a baseball or brotherly love. You were wrestling with your brother. And what happens is we have this small articular disc inside our temporomandibular.
Cheerleaders and gymnasts are the worst.
It doesn't
discriminate.
discriminate, So, and so what happens is the jaw is the only biarticulating joint in the body. I mean, your elbow works independently, wrists, knees, all that kind of stuff. But your jaw wants symmetry. And, usually the affected side heals with either some scar tissue or breaks down. You lose the synovial fluid inside there. You start
Adaptation,
starts to creep in, And so what happens is in the middle of the night when you're sleeping, the masseter muscle, the temporalis muscle, and the pterygoid muscles are all connected to this articular disc. And it wants symmetry. So in the middle of the night, it contracts all night long, trying to put this articular disc back in its normal position. It's never going to be normal. It will never be, but it tries every single
once
night.
those ligaments are stretched, it's a loss.
Does you.
Yeah.
And so patients are actually grinding about 1,000 times a night. So if you were to do 1,000 sit-ups today, you might wake up and your stomach might be.
That ain't gonna happen. I'm still working on 5. Okay.
The point is, I have patients that are coming in excruciating pain, going to the ERs at night, going to get God forbid, some Oxycontin, or they're going to get a morphine shot, and then everybody's going down the rabbit hole, send you to a neurologist.
So many are seeing ads on Instagram from like med spas that are just jamming Botox into these muscles and kind of hiding what the real problem is.
Retort to that is like, okay, great, you're going to get a little Botox in your masseter muscle. What about your temporalis muscle?
Yeah.
What about your pterygoid muscles? Those muscles, and they're still working.
Right.
So you still wake up with the headaches, but great, you can't feel the right side of your face.
Right.
That's no good, right?
Well, and when they do just the masseter, what I find is people end up getting headaches because the temporalis is working harder to compensate for the masseter that's not working.
Yeah,
so
sure.
Yeah.
Well, there's also the intentional with the night guard, and it has to be hard on the top portion.
100%
is because we have that little mesencephalic ganglion that basically tells you, hey, if it's hard, it's like biting down on a chicken bone or a rock or something. Stop biting down. Whereas if you have something that's purely rubber, it exacerbates the problem. Like you just keep on grinding.
God forbid, but I'm not calling CVS out, but the CVS mouth guard that's rubbery and they come back worse.
It's awful,
Yeah.
right? So we've iterated on this and gotten it to the point where it's just perfect. We have 2 sizes actually. One size was usually fit all, but we have 2 sizes, which is called our G1 and our G2 series.
Okay.
The G2 series are for people that have had orthodontia. Maybe they had their bicuspids pulled out. So the G2 actually fits on the canine bicuspid and overlaps on the molar. And the G1 is for people that have both bicuspids in there. And you can tweak.
That's a lot of patients in my practice.
Sadly, depending on they have a retained primary tooth, or they have some missing teeth and all that good stuff.
Right.
So so that's what that does. And then this sensor, listen, a lot of people aren't going to integrate with a sensor because they don't like to geek out like I do. I look at my metrics, my sleep scores, my restorative scores, all of that kind of stuff on a nightly basis. But if you want to do this, we've also integrated with we get all the APIs from Fitbit and Whoop and Apple Watch and the Aura Ring to be able to download your sleep metrics onto your dashboard.
Oh, love that.
From Asesso Health. So we give back some very intentional and thoughtful metrics on grinding scores, how many times a night you grind in each hour of the night, how much better you're getting, the percentages on that. And we've been showing that grinding, for instance, has improved somewhere between the 36 and 66%. Your muscle fatigue has improved about 60% as well. Your restorative sleep has increased about 18 basis points, which equates to about 81%
Okay.
of restorative sleep. Because you can imagine, if you're grinding at night, you're essentially getting a full head workout in the middle of the night, which keeps you in light sleep because you're working out. So you have the endorphins, part of the autonomic nervous system, all of that good stuff, and you get measurably poor sleep. Well, by placing this in, we're showing that people are actually getting more restorative sleep and they're not having as many awake disturbances in the middle of the night. So it's super impactful for patients, right? We're about to embark on this full FDA, process where we do sleep studies, and this is all.
Yeah, and this is what I'm going to be talking to you about because there's so much crossover between TMD and sleep disturbance and nocturnal bruxism.
Yeah.
There's so much crossover, and this is actually going to be part of the diagnosis in how I plan to use this.
Yeah.
Which is to say, okay, the bruxism, why isn't the bruxism improving here? Well, now we start to go down, if there wasn't another indication of sleep-related breathing disorder, now let's look at that because that could be behind the remainder of the sleep bruxism that's here. So,
And we want to correlate that too, sleep apnea.
plus I'm going to use your positional data to correlate with my home sleep tests.
And sleep apnea has become a really big topic of late.
Huge.
Everybody's pushing, CPAPs, and, you push some positive air pressure and, hey, you're getting more oxygen, which is probably great for you, by the way. I'm actually thinking, my wife uses one. I'm thinking about doing it just because I'm like, hey, it doesn't sound like it's a bad thing. But, I think that, somewhere there's a balance in between. And I need all the confluence of interdisciplinary measures, expert from the dentist, experts from, the medical standpoint, and also from, the physical therapist standpoint. We all need to kind of come together and kind of really find out what's working here,
right,
in conjunction with one another. So,
it's just so nice to hear that coming from a specialist, right? That's
I'm feeling like,
well, it is. Usually once stuff gets to you, it's like, hey, I got to do what this general dentist is asking me to do because otherwise he's not going to refer he or she.
Kind of slippery slope.
Yeah, is not going to refer me anymore.
Like, just do the root canal or like just do this, and it's just like, gosh, like hey, again, I've been very intentional the whole time. Like, I have the best interests of the patient at
very no
front of my mind, and I want to help the patient, and I see the pain and suffering that they have coming in. Like I said, 15% on a daily basis, these patients have pain, in acute pain, headaches, migraines, and the poor sleep. So, yeah, so I really, I'm on a crusade to help people is what and so that's where we're at.
And so how does a dentist begin providing these? Because for me, anything that I can do where there's an immediate solution or at least begin the pathway to healing, as opposed to saying, yeah, this is a really bad problem. Come back in about 3 weeks and we'll start fixing it.
Yeah, Jeff, thanks for bringing that out because I'm a proud dentist, and very privileged to be part of this society, and it's really important for me to kind of get this educational message across to dentists, right? Because it's a pervasive problem. And so the intention here was, okay, if you can deliver a night guard, grind guard, whatever you want to call it, or complete solution that day, that's the most impactful thing that could actually happen. And so what we wanted to do is we want to mitigate the cost between the labs and the time that it took for the labs to make the orthotic and deliver it to the patients. Great. You would hate to tell a patient you're in pain, but, wait 5 weeks until we get the orthotic back from the lab. That really doesn't go over well. So I wanted it to be less intrusive on the dentist and a very easy solution to be able to give to their patient that day. So, we wanted to mitigate those costs from the lab again. We charge $229, which is essentially about the cost of the orthotic, depending on you're printing it yourself or sending it out or whatever you're doing. Alternate impressions, assistance time, your time, all that good stuff. and basically sell this to the dentist. The dentist becomes the reseller, and they can charge the patient or the insurance companies whatever they feel like their self-worth in this whole endeavor is. If you sat down and coached up your patient and told them from a TMD perspective what was actually happening, if you wanted to spend a half an hour or 45 minutes telling them,
Right.
you could do that. Your cost basis may be a little bit more. I don't care. Like, you dictate what that price is to you. If you want to just tell them this is what you need, have your assistant fit it and send them on their way, charge whatever you want. For the cost. I don't really care.
And just to be clear, because we had a chance to talk about this, because I was so interested in it. I know I'm going to implement this within my practice. They can also, if there is not a need for the sensor and the feedback on it, these can also be purchased without that at a lower cost.
They can just buy the card. We actually sell the cards to the dentist. There's a profile section on our website, dentist portal. Basically, you sign up on the dental portal. You can order whatever it is you want, batches of 15 or 35.
Yeah.
Listen, in my office, I'm selling 20 to 25 of these complete solutions a month. I'm an endodontist. Yeah, I see 8 patients. You're a general dentist. You see 50 or 70, I don't know what you see, but it's a heck of a lot more than me. And I'm selling 25 of these a month. I know that the modeling works, and I know there's a massive need for this. Your patients are actually starving for this.
Yeah.
I'm telling you, and you get to be their hero. So, anyway, it's very impactful.
Yeah.
You could, so the problem with, I want to sell this to dentists, but you could buy this online if you're a consumer through the e-commerce brand. You could buy it, but there's frictions associated with that. You actually have to boil the water. You have to put it in. You have to make sure it's fit. And, we have tutorials where you can do that kind of stuff too, how they fit it. But you know what? They never fit it like they do in the dental office. I mean,
It is never going to be the same.
And our whole thing is, it's a full compliancy thing. We want patients to wear these because it actually works and it helps them out. So my intention is to get this in the hands of dentists, as many dentists as I possibly can get to. And we're just dipping our toe in the water right now. So, our big toe. And so anyway, that's where we are.
Well, I am excited to have met you. I'm excited about, I love when I find someone else who's passionate about functional dentistry and looking beyond the teeth, and especially when I hear it from an endodontist or, a specialist. So what a pleasure meeting you. I can't wait to begin using these in my practice. And also, having a back and forth where we talk about how some of this feedback that we're getting, how some of these metrics are also guiding us in our sleep therapies and in our diagnosis. So
we still have a lot to do here. As you can imagine, we've already done a lot.
But I think it'll be a fun journey. Phil, what a pleasure meeting you. Asesso Health.
AsessoHealth.com.
Please look them up. And I'm sure we'll be talking again. So, all right, everyone. Jeff Horowitz, Dentist in the Know, Chicago Midwinter Dental Meeting. Check out Asesso Health.